In regards to Sarah's assessment, my working diagnosis would be gonococcal pharyngitis. Some differentials would include chlamydial infection of the pharynx and or anus or rectum, HIV infection, viral meningitis, infectious mononucleosis, streptococcal pharyngitis, acute viral URI, or acute sinusitis. My plan for Sarah in regards to labs and diagnostics would include throat, vaginal and or cervical and anal cultures to test for other STIs and pathogens. For the throat culture, I want to be able to test between streptococcal versus gonococcal infection. I would also test her urine for pregnancy and for a UTI. I would do a pelvic exam if she allowed me to assess the cervix and vagina for any inflammation, cervical tenderness, or bleeding. And I would lastly consider blood tests to test for HIV and mononucleosis. I may or may not consider testing her blood for a CBC or BMP, just based on her presentation and the information I gather from her subjective and objective exams. I would really only consider the CBC and BMP if I thought she might be anemic or have a systemic infection, or if I thought she was dehydrated, had been vomiting or having diarrhea, and may be experiencing some electrolyte disturbances. Treatment for Sarah would include a 250 milligram intramuscular dose of Rocephin plus a 1 gram oral dose of azithromycin, just a one-time dose of both. I would also encourage her to use over-the-counter mild analgesics such as Tylenol or Motrin to help with the throat pain on an as-needed basis. In regards to Sarah's education and health maintenance, I would advise her that she should contact all sexual partners that she's had within the past 2 months and advise them that they should be treated. I would ask her to refrain from all sexual activity for 7 days. I would advise her of possible adverse reactions to the antibiotics and explain that it can take 1 to 2 days to get relief after starting antibiotics, that if her symptoms continue to worsen after 2 to 3 days, that she should return to the clinic. I would also educate her on the appropriate use of contraceptives for both pregnancy and STI prevention. I would offer her choices and discuss the risks versus benefits of the various options. I would also counsel Sarah on alcohol and drug use, misuse, encourage smoking cessation. I would screen for depression, encourage her to begin breast self-exams and teach her how to do so. I would promote skin cancer awareness and also promote healthy diet and exercise habits. References for this midterm OSP include the Butaro Primary Care Text, the Centers for Medicare and Medicaid Services ICD-10 coding, the Lang Obstetrics and Gynecology text, my own antimicrobial text, Schwartz's Textbook of Physical Diagnoses, History and Exam, and the U.S. Department of Health and Human Services AHRQ guidelines. Thank you.